Hello everyone. Today we will be discussing about the axilla or the armpit. So in this module we will be covering a whole lot of anatomy, and let's dive right into this topic without wasting any time. So I encourage you to grab a piece of paper so that you can draw the diagrams along with me, because this will be very useful for you. So the axilla or the armpit is a fat-filled space between the upper part of the arm and the side of the chest wall. So here in this diagram, you can see the location of the axilla. So it basically contains the brachial plexus, the axillary vessels, and the lymph nodes. It acts like a funnel-shaped tunnel for these neurovascular structures to pass from the root of the neck to the upper limb and vice versa. So this is a four-sided pyramid. It resembles a four-sided pyramid. It has an apex base, four walls: anterior, posterior, medial, and lateral walls. So we will be looking into the details of these structures. So in the apex, it is bounded by the clavicle in front, behind by the upper border of the scapula, and medially by the outer border of the first rib. So I want you to just draw this diagram real quick with me. So we have the clavicle anteriorly, we have the upper border of the scapula behind, and the outer border of the first rib medially. So I hope that is clear. This is about the boundaries of the cervico-axillary canal. Now, why do we call the apex the cervico-axillary canal? It is because it helps in the passage of the structures from the neck, the axillary artery and the brachial plexus. They enter the axilla from the neck through this gap. So it is called the cervico-axillary canal. Now moving on to the base or the floor. So the base is at the lower end of the axilla, and it is formed by the axillary fascia. So the base corresponds to a hollow, and in front we have the anterior axillary fold, and behind is the posterior axillary fold. Now what forms the anterior axillary fold is the lower border. Now note, it is the lower border of the pectoralis major, and posterior axillary fold is formed by the tendon of the latissimus dorsi and the teres major muscles. So that is about the base or the floor of the axilla. So now talking about the anterior wall. So it is formed by the pectoralis major, pectoralis minor, and a small muscle we have, that is the subclavius muscle. Posterior wall is formed by the subscapularis above and the latissimus dorsi and teres major muscles below. And medial wall is formed by the upper 4 or 5 ribs and corresponding intercostal spaces covered by the serratus anterior muscle. And we have laterally the short head of biceps, the tendon of biceps, and the coracobrachialis. Now moving on to the contents, we have the axillary artery and its branches, the axillary vein and its tributaries. Note that it is tributaries, not branches when it comes to vein. With the cords of the brachial plexus, with the axillary lymph nodes. There is a fibrofatty tissue. There is the axillary tail of breast. And we have the nerves. We have the long thoracic and the intercostobrachial nerves. So these are the contents of the axilla, and we will be discussing these contents in the later modules. So now let us go back to the diagram which I told you we'll draw. So this is the boundaries and contents of the axilla as seen in the horizontal section. So let us draw the bones. So we have the scapula, the humerus, and the rib in this diagram, right? So we have drawn these. I want you to draw this with me. And now we'll move on to drawing the axillary sheath. We'll draw it in green and mark the contents inside it. So we have the axillary vein, the cords of the brachial plexus, and the axillary artery. Now coming on to the muscles. First we'll draw the subscapularis muscle. Then we'll draw the teres major and the latissimus dorsi muscles. Then we'll draw the pectoralis major muscle. and beneath it will be the pectoralis minor muscle. Drawing the serratus anterior muscle. And the nerve to the serratus anterior muscle. And then finally the tendons, the biceps long head, biceps short head, and the coracobrachialis. Now marking all these structures up. So that is it about the introduction to axilla. Thank you.